Hi, everybody. How's everybody doing? It's Susan from Susan's New Era. Hope everybody's doing well. So I thought I'd come to you today because I mentioned in a prior video about being your own advocate. If you haven't seen that video, shameless plug here, go see it. Anyway, I thought I'd talk about my history of spine surgery. I have a long history of spine issues since I was in the age of my 20s when I was a hairdresser standing for 9 hours a day, 5 days a week. And that boss wouldn't let us have a pad under our feet because he didn't like the way it looked. Yeah, 6 years. Yeah. So I remember when, in my youngest days, so in my early 20s, I went to, at the time, like HMO group, just a large group. And the doctor said, take such and such every 6 hours. It was an NSAID aspirin. And I think things have changed a lot because they don't have you taking 1,000 milligrams of aspirin 4 times a day anymore. Yeah, no, they don't do that. This was in the era, if you're older like me, you remember when ibuprofen was a prescription medicine and it wasn't over the counter. Yeah, I'm showing my age now. I know. Oh. Anyway, as the years progressed, I managed with over the counter heating pads, rest. And when I hit in my early 50s, yeah, everything broke loose. I was having the lower back pain, and I was a nurse. And if you know what nurses do in a hospital setting, they walk patients that are unstable to the bathroom. They support patients when they're falling so that they don't fall. They just land lightly on their bum. And they move people up in bed. Sometimes there was just two of us to move a 200, 250-pound person because, yeah, we weren't overstaffed and we didn't have a lift team. Yeah. So about 2017, my mother had passed. And moving her stuff out of her little memory care facility was my husband's and my job. I remember it was painful. About that time, I remember shopping with my daughter, and we were in a store. Luckily, they had a bench, and I just remember, honey, I'll be over here on the bench. My back was hurting so bad. So it took me a while, quite a while, to progress towards surgery. One of the reasons was I had a PPO at the time. Yeah, PPO versus HMO. You think the PPO is better until I went to this one doctor who's very thorough. And she ordered $2,500 worth of labs to make sure everything was healthy. Yeah, I got a bill for $250. Apparently, I paid 10% up to a certain amount. I had to pay a $250 bill for that. So later on, unfortunately, I had to give that doctor up because I had to switch to a different system that, yeah, I had less copay. So I went on a plan through my work, and a friend had referred a doctor, and she started out being very good. She got my MRI, which I had always been afraid of before after that lab incident. What was the copayment? Nobody can tell you. I called the radiology company. I called insurance. I called my doctors. And nobody could tell me if I was going to have a copay or how much it was. So I put it off. Yeah, I've worked awfully hard for my money. I don't give it up easily. So now I had this different plan, and I had this new doctor, and she got me my MRI. And immediately within 48 hours, I found out, yeah, I had some real issues worthy of potential surgery. So I did 4 months of physical therapy. And I did work in a hospital that had an orthopedic spine surgeon that was highly recommended by several of the doctors I really trusted and some of my coworkers that worked in the OR. So I went as an outpatient to his office, and he explained to me that I was going to need some hardware, rods and screws, stabilization. I can't remember exactly what the diagnosis was. I went back and looking in my papers, I could find it. But basically, he had ordered more x-rays, and when I moved and reached up, the bone was slipping past the lower bone and pinching off, severely pinching off the nerves. So apparently I needed stabilization because by this point, I had pain down my leg, pain into my foot and toes, and I was tripping a lot because my foot I didn't have real good control towards the toes area. I was falling a lot. I thought, why I'm getting clumsy? But it was always tripping on my right side. So this whole process took me about a year because I don't enter these things lightly. I researched it. I thought about it. I considered what this could do to my job. Am I going to be able to work as a registered nurse at the bedside? The idea of potentially trying to take a job where I worked in an office on a keyboard, that wasn't why I became a nurse. I became a nurse because I wanted to help people at the bedside. So I ended up going to a different doctor after my female doctor because she started getting like irritated at me and I think the breaking point for me was when she said, "So what is it you want today, Susan?" Yeah, luckily I had a insurance that had a nurse advisor that could help me find a better doctor in my area. And I did. And I've had him for 5 years now. Yeah. Moving back to the spine surgery. After a few visits, multiple x rays, MRIs, EEG, EEG, that's where you go and they send an impulse of electricity down your leg to see how it's responding, how it's traveling. Yeah, you know, something like that. Hadn't heard of it before I had this. Yeah, it's a little painful. Not bad. I was glad I took the rest of the day off, though. It was one of those days. Yeah, we planned. I said I want my surgery in October. And this must have been late spring. Doc said, okay. Then he asked me which hospital. Apparently my insurance covered 5 different hospitals in the area. And I chose to have surgery at the hospital I work at, county hospital, because I knew my friends would take care of me. And it was a wonderful experience. So on the day of surgery, of course, I was nothing by mouth after midnight. And my husband drove me in. And we checked in through my same-day surgery unit. My friends did my IV, asked all the questions. That was a little uncomfortable, telling them some of my health history. You know, you work with people, but you don't tell them every single little detail. And then they rolled me back to the holding area, and I talked to my doctor. Now, this is a hospital with residents, so I told my doc, you're the attending, I want you to do the surgery. I don't mind them helping, but you're the incision maker, you're the driller, I don't mind if they suture it up, but I want you to do it. And he said, yes, I'll do that. So after surgery, I woke up in recovery room with less pain than when I came in with. Those compressed nerves that were shooting pains down my leg were resolved. Yeah, I had pain in my 6-inch incision in my back, but it was nothing like the agonizing shooting pains down my leg and my foot and lack of control, my ankle, foot. It was like, oh, like that moment. I was so grateful. So grateful. After recovery room, they rolled me to my room. Met my nurse. She was very kind. And within a few hours, when doctors came by, I showed them I could stand up and take a few steps. And I got permission to walk to the bathroom the same day I had surgery. Stayed overnight. The next morning, physical therapy came. I walked down the hallway. Yes, I held the cane they wanted me to hold on to, and I carried it. And then they said, well, you have stairs in your house. You gotta make sure you can do stairs. So, yeah, I did like 4 stairs up and down. I did well. I didn't really have physical therapy after surgery. I probably could have asked for it. Mostly, they said, just keep doing what you're doing. Walk down your street. So within a couple of days of surgery, I was walking down my driveway, past my house, and halfway past the other house. Within a month, I was walking the whole long cul-de-sac I live on, plus exploring down some of the streets. Then 2 months, I was doing a couple miles a day. Yeah, 3 months I had to go back to work. Yeah, I was scared. I had the best coworkers ever. They protected me. If I had a patient that needed to be lifted, they were right there. Susan, you don't lift this patient. We'll lift them for you. And we were such a wonderful team that I worked with. My friends took care of me. They weren't just coworkers, they were friends, and I appreciate them so much. Anyway, in this process, I learned you go see your doctor, your primary. They order tests, they get results. If something needs to be taken care of, they do a referral for your specialist. You see the specialist, they then have to get approval by the insurance company for whatever they propose. You might have to go for more tests. There's approvals. You get to know your insurance company. You get to know their phone numbers and your ID number. You get to know calling the referral coordinator at your doctor's office or your specialist and asking if it was approved. Always want to make sure it's approved. Don't want a big bill. I remember calling, make sure my hospital was covered, my anesthesia was covered, because anesthesiologists usually work under a separate contract from the hospital. So you want to make sure your anesthesiologist in that hospital is covered and that you're not going to have any surprise bills. My hospital bill that the insurance was billed was $100,000. I had a really good insurance plan. My copay was $100. It was a great thing. One of the things I did discover doing my research before surgery was when you get a certain part of your spine stabilized, which reduces some of the flexibility, you can have further degeneration above that area. Yeah, I have that. Immediately within 6 months, my L3, L4, bone on bone. Yeah. Now, I do have family history. Mom had bad back for years. My mom was not very progressive about seeking out help. She's old school. She lived with it. So it's an ongoing adventure. But that was my spine history, spine surgery. And I'm still in the seeking of the spine relief, pain relief. 2024 will probably be my year of my nerve stimulator implant. It's a process. See your primary, insurance approves, referral approved, see the specialist, approved or not approved. You know, when I was younger, things weren't as bad. Oral medication, over-the-counter treatment, or whatever. Back in the day, prescription ibuprofen, which now you can get over the counter. Yeah. You do want to watch your ibuprofen, your NSAIDs. My mother at 90 had decreased renal function, and they think it was from 40 years of NSAID use. So, you know, ask your doctor. Always ask your doctor. Research. Yeah. I take a herbal supplement sometimes. That'd be a different video. Anyway, Susan's new era. Thanks for coming by. Like, subscribe, comment. Have a great day.